Hello and welcome. Today, we're delving into a fascinating and often debilitating condition called Meniere's disease. This inner ear disorder can significantly impact balance and hearing, affecting a person's daily life in profound ways. Join us as we explore its causes, symptoms, diagnosis, and treatment options. The exact cause of Meniere's disease remains somewhat of a mystery. However, current theories point towards an abnormality in the fluid volume or composition within the inner ear. This delicate balance of fluid, called endolymph, is crucial for proper hearing and balance. Genetic predisposition, viral infections, autoimmune reactions, and even head trauma have all been suggested as potential contributing factors. It's likely that a combination of these factors, rather than a single cause, ultimately leads to the development of Meniere's disease. Let's understand what's happening inside the ear. Meniere's disease specifically affects the endolymphatic sac and duct, which are responsible for regulating the fluid volume in the inner ear. When these structures malfunction, endolymph can build up, causing swelling or distension of the endolymphatic space, a condition called endolymphatic hydrops. This distension disrupts the normal function of the hair cells responsible for hearing and balance signals, resulting in the characteristic symptoms of the disease. Meniere's disease affects people of all ages, but it most commonly begins between the ages of 20 and 60. It's estimated that Meniere's disease affects around 1 in 1,000 people. There's no significant difference in prevalence between men and women, and while it can occur in people of all ethnic backgrounds, some studies suggest a slightly higher prevalence in Caucasians. The symptoms of Meniere's disease can be quite varied, but they often manifest in episodes or attacks. These attacks are typically characterized by vertigo, which is a sensation of spinning or whirling. This vertigo can be so intense that it leads to nausea, vomiting, and difficulty walking. In addition to vertigo, individuals often experience tinnitus, a ringing, buzzing, or roaring sound in the ear, as well as fluctuating hearing loss, which usually affects one ear initially. A feeling of fullness or pressure in the affected ear is also a common symptom. These episodes can last anywhere from 20 minutes to several hours, and their frequency can vary greatly from person to person. Diagnosing Meniere's disease requires a comprehensive evaluation by a healthcare professional, typically an audiologist or otolaryngologist. This evaluation includes a thorough medical history, physical examination, and several diagnostic tests. Hearing tests, or audiometry, are used to assess the type and degree of hearing loss. Vestibular tests, such as electronystagmography (ENG) or videonystagmography (NG), evaluate the function of the balance system. An MRI of the brain may be performed to rule out other potential causes of the symptoms. The American Academy of Otolaryngology, Head and Neck Surgery (AAOHNS) has established diagnostic criteria, which are often used to confirm a diagnosis of Meniere's disease. While Meniere's disease doesn't have distinct subtypes, it can be classified based on the stage or severity of the condition. Early-stage Meniere's disease is characterized by fluctuating symptoms and hearing loss. As the disease progresses, hearing loss may become more permanent and the frequency and intensity of vertigo attacks may change. In advanced stages, balance problems can become more persistent, even between episodes. Unfortunately, there is no cure for Meniere's disease, but there are several treatment options available to manage the symptoms and improve quality of life. During acute vertigo attacks, medications like antihistamines, antiemetics, and sedatives can help to relieve nausea and dizziness. Long-term management often involves dietary changes, such as limiting salt intake and avoiding caffeine and alcohol, which can exacerbate symptoms. Diuretics may also be prescribed to reduce fluid retention. In some cases, physical therapy or vestibular rehabilitation can help to improve balance and reduce the severity of vertigo. For individuals with severe, debilitating symptoms that are not responsive to conservative treatments, more invasive options, such as endolymphatic sac decompression, gentamicin injections into the middle ear, or even surgery to sever the vestibular nerve, may be considered. Hearing aids can also be helpful for managing hearing loss. As the underlying cause of Meniere's disease is not fully understood, true prevention is currently not possible. However, managing risk factors and adopting healthy lifestyle habits may help to reduce the severity or frequency of attacks. This includes limiting salt, caffeine, and alcohol intake, managing stress levels, and avoiding triggers that are known to worsen symptoms. Protecting your hearing from loud noises and promptly addressing any ear infections may also be beneficial. The prognosis for individuals with Meniere's disease is variable. Some people experience relatively mild symptoms with infrequent attacks, while others have more severe and debilitating symptoms that significantly impact their daily lives. In many cases, the frequency and intensity of vertigo attacks tend to decrease over time, although hearing loss may progress. Ongoing research is focused on identifying the underlying causes of Meniere's disease and developing more effective treatments. Recent advances include the investigation of novel drug therapies targeting specific pathways involved in endolymphatic eye drops, as well as the development of minimally invasive surgical techniques to improve balance function. Scientists are also exploring the role of genetics and biomarkers in predicting disease progression and response to treatment. With continued research and advancements in medical technology, the future looks promising for individuals living with Meniere's disease.